Okay, good morning. Thank you, Joyce, for the kind introduction and the invitation. Someone said earlier, you have to obey Joyce. That's what happened to me when I got the invitation from Joyce several months ago. So even though I have never met her before, so she's very compelling, you can tell. So what I'm going to do is to look at food and diets through a different lens, a lens of epidemiologist, a medical doctor, and a public health professional. I want to start by posing a question to you. What are the major causes of death worldwide? I think the answer is pretty clear. The major causes of death are chronic non-communicable diseases such as heart disease, stroke, cancer, diabetes, Alzheimer's disease, and so on and so forth. But you can also answer the question through in a different way, because those diseases are caused by risk factors. So this is a list of top 10 risk factors for chronic diseases. The number one risk factor for chronic disease is actually unhealthy diet, followed by tobacco smoking, high blood pressure, obesity, high blood sugar, high cholesterol, low physical activity, and air pollution. So among those top 10 risk factors for chronic disease and for premature death, unhealthy diet is actually the number one killer, So when we ask the question, what are the major causes of death globally, you can say chronic disease, but you can also say unhealthy diet and lifestyle. So that's why it's so important to talk about diet when we talk about longevity and the prevention of chronic diseases. Every 5 years, the United States government releases the dietary guidelines for Americans. This is a very important document. It has huge implications for food policies and nutrition policies in the US, because by law, the government agencies, especially the food assistance programs, such as the school lunch programs, the food stamp programs, and so on and so forth, have to follow the recommendations from the dietary guidelines. And the purpose of the dietary guidelines is to make recommendations based on the current scientific medical knowledge for the prevention, not treatment of chronic diseases. The reason why it's so important for food and nutrition policies is because the target audience of this document is not just for nutrition researchers or educators or health professionals, but also for policy makers. What is the scientific basis of the dietary guidelines for Americans? The scientific basis is actually the Dietary Guideline Advisory Committee report produced by leading experts in the US. I was very privileged to serve on the 2015 the US Dietary Guideline Advisory Committee. We spent almost 2 years reviewing vast amount of literature on diet and health, and produced this report, almost 600 pages. If you don't have anything to read, you can read it at your bedtime. It includes a massive amount of data, scientific literature, hundreds, perhaps thousands of original papers on diet and health. And in this report, we identified major problems in the US dietary patterns, in the food systems, and also we identified interventions that can be effective in changing individuals' behaviors and also changing the food and the physical activity environments. But a major breakthrough in the 2015 Dietary Guideline Scientific Report is that this is the first time the Dietary Guideline Advisory Committee took into account the environmental impact of food production and food consumption in developing the dietary guidelines. So this is the first time the report actually included a whole chapter on environmental sustainability and food systems. And in the recommendations that made by the committee, we stated that diet higher in plant-based foods and lower in animal-based foods is healthier and has less environmental impact. So again, the reason it's the breakthrough is the first time that we look at human health and the health of the planet at the same time when we're making recommendations for improving the health of the people. The dietary patterns recommended by the dietary guidelines are primarily plant-based, including high amount of fruits and vegetables, whole grains, legumes, nuts, and seeds, lower intake of red meat and processed meat, sugar-sweetened foods and beverages, and also lower intake of highly processed refined grains. An important point made by the committee is that one size doesn't fit all. There are multiple healthy dietary patterns, and people can adapt a healthy dietary pattern according to individual food and cultural preferences and their health conditions. And a healthy dietary pattern, as I mentioned earlier, is not just beneficial for the health of humans, but also for environmental impact. The committee recommended 3 healthy dietary patterns: the healthy US style pattern. Here, I'm not talking about the McDonald's diet or the Kentucky Fried Chicken diet. We're talking about a healthy US style dietary pattern, a healthy vegetarian pattern, and a healthy Mediterranean style dietary pattern. This is the first time that the US dietary guidelines recommend the vegetarian dietary pattern as one of the healthy eating patterns for promoting human health. The committee also recommends limiting consumption of sodium, saturated fat, and added sugar because those nutrients typically represent poor diet quality, and higher consumption of sodium, saturated fat, and added sugar has been associated with increased risk of chronic diseases and premature death. In the past several years, there has been a lot of controversy regarding saturated fat intake and cardiovascular disease. Some of you, if you read the US newspapers, you may have seen those sensational headlines like butter is back, eat butter, is butter really back? I don't know whether this is true in the UK, but saturated fat, the media has been saturated with saturated fat in the past several years. Based on the current literature, the committee concluded that saturated fat is not a healthy type of fat. In fact, there is strong evidence that if you eat more unsaturated fats from plant-based foods instead of saturated fat, you can actually reduce your LDL cholesterol, which is a bad cholesterol, and also risk of cardiovascular disease. Therefore, the committee recommends retaining the 10% upper limit for saturated fat. In a study we published 2 years ago, we found that compared to unsaturated fats from nuts, seeds, vegetable oils, and seafood, higher consumption of saturated fat is actually associated with increased risk of cardiovascular disease. However, if you replace saturated fat with highly processed refined carbohydrates or added sugar, that's not going to do you any good either. So it means that a high saturated fat diet is as bad as a high sugar diet. And a healthy dietary pattern should include healthy type of fats and also healthy type of carbohydrates. In a study we published last year, we specifically look at the type of fats and the risk of mortality. As you would expect, trans fat is the worst type of fat. It's produced from partially hydrogenated vegetable oils, and is a major risk factor for heart disease. Higher consumption of saturated fat from animal products is also associated with increased risk of mortality. On the other hand, higher consumption of unsaturated fats from plant-based foods, such as nuts, seeds, vegetable oils, avocados, is associated with lower risk of mortality. So this means that not all fats are created equal. There are good fats and bad fats. We should use good fats to replace the unhealthy fats, such as saturated fat and trans fat. There is increasing evidence that regular consumption of red meat is associated with increased risk of chronic diseases and premature deaths. In a study we published several years ago, we found that higher consumption of both unprocessed and processed red meat is associated with increased risk of total mortality, cardiovascular mortality, and also cancer mortality. We estimated that if the US population reduce their consumption of red meat from 1 to 2 servings per day to only half serving per day, that could reduce premature deaths by almost 10% in men and 8% in women. So it means that when people move from a red meat-based diet to a more plant-based diet, that can save a lot of lives. There is strong evidence that red meat consumption is also a risk factor for type 2 diabetes. We know that type 2 diabetes is primarily caused by overweight and obesity, and is caused by high amount of blood sugar. In recent years, there is strong evidence that regular consumption of red meat, especially processed red meat, is associated with increased risk of diabetes. In this meta-analysis, we found 1 serving per day of unprocessed red meat consumption is associated with 11% increased risk of diabetes, and 1 serving per day of processed red meat, such as hot dogs, bacon, and sausages, is associated with 30% increased risk of diabetes. We know that protein is an essential nutrient. Without protein, we wouldn't be able to survive. However, there is a myth that we need to eat more protein for better health. However, this is not supported by scientific data. In the US population, consumption of animal protein has actually decreased in the past several decades, whereas consumption of plant protein has increased. However, in developing countries which are undergoing nutrition transition and economic development, the consumption of animal protein is increasing very rapidly. In a study we published last year, we found that overconsumption of animal protein is actually not healthy in terms of mortality. On the contrary, higher consumption of animal protein is associated with slightly higher mortality, especially cardiovascular mortality. On the other hand, regular consumption or higher consumption of plant protein is associated with lower risk of premature death. We estimate the effects of replacing animal protein sources with plant protein on premature death. We found that if you replace animal protein sources, any of these animal protein sources with plant protein, there is significant benefit in terms of reducing mortality. The largest reduction was found for those people who replace processed red meat with plant protein sources. So this data suggests that for human health, it's better to consume more plant-based protein at the expenses of some animal protein sources. So why do plant-based foods, such as fruits and vegetables, nuts, seeds, have so many health benefits? One potential mechanism, biological mechanism, is that those foods contain high amount of polyphenols. Polyphenols are bioactive compounds that are highly present or abundant in a wide range of plant-based foods. There are many species of polyphenols in plant foods. The main species include phenolic acid in coffee, lignans in flaxseed, whole grains, and lentils, flavonoids in fruits and vegetables, and also soy products, and resveratrol in red wine. So when you ingest those plant-based foods, the bacteria in your gut will metabolize those bioactive compounds and produce molecules that can have anti-inflammatory effects, can actually reduce insulin resistance, risk of type 2 diabetes, and cardiovascular disease. There is now emerging and also very exciting scientific evidence that the bacteria in your gut play a very important role in health. The gut microbiome has been linked to a wide range of diseases, including obesity, diabetes, cardiovascular disease, and even some cancers. Many studies have shown that diet can actually alter human gut microbiome. So when people switch from an animal-based diet to a plant-based diet, their bacteria, the type of bacteria and the abundance of bacteria can change very quickly, within days. So when you eat a healthy plant-based diet, you're going to have more healthy bacteria in the gut and less unhealthy bacteria in the gut. So it means that when we eat, we're not just feeding ourselves, our own body, but also billions of bacteria in our gut. So I think the evidence is very compelling that a plant-based dietary pattern is beneficial for human health. If we eat a healthy dietary pattern, either a Mediterranean, traditional Mediterranean dietary pattern, or healthy vegetarian pattern, or other type of healthy dietary patterns, we can substantially reduce risk of chronic diseases such as type 2 diabetes, cardiovascular disease, and cancer. In those healthy dietary patterns, the consumption of red meat and processed meat is typically moderate, whereas consumption of plant-based foods such as fruits and vegetables, whole grains, nuts, and legumes is abundant. This is the healthy eating plate developed by our department, and this plate has been translated into 30 different languages. It has become very effective and useful tool to educate the general public and the health professionals about healthy eating. And this plate focuses on healthy plant-based foods, such as fruits and vegetables, whole grains, and healthy protein foods. And it also emphasizes on healthy oils and healthy beverages. Of course, you have to stay active while eating a healthy diet. Thank you very much for your attention.